Welcome to another episode of Friday Reports. Today, in episode 3, we're going to be talking about golf ball injuries to the eye.
Hi, thanks for joining us. Golf ball injuries to the eye is very interesting because it happens 40,000 times per year. And even though it's less than 1% of all eye injuries, it is very common, especially if I practice near golf courses, and I'm in San Jose, California, and there are a lot of golf courses. So in the space of 6 months, I've seen 6 of them. What happens, the golf ball fits into your eye socket right inside. It's unfortunately the same size as your eyeball, so it can really cause a devastating injury. The most widely publicized golf ball injury to the eye happened in the Ryder Cup 2018 in Paris, a suburb of Paris. And a woman flew from Egypt to Paris to be a spectator, and it was Brooks Koepka, who was a golf pro, who hit the ball towards the spectator area, and she took the injury, unfortunately, in the eye, and she lost her eye, so that eye never could see again. We don't know exactly what happened afterwards, except that she was hospitalized. We don't know what changes the golf tour and the golf officials made towards this type of injury, but it is unfortunately a devastating injury to the eye. 23% of these golf injuries happen with the golf club, and 16% involve a golf ball. So we have a patient here, one of my own patients, who's 40 years old. He was hit in the eye, and you could see this kind of shimmering gold area in the retina, the inside lining of the eye. Luckily for him, within 1 month, this disappeared and he became normal. So he was lucky that the golf ball hit the outer edge of his socket, the bony part of the eye, and he didn't take it straight inside the main part of the eye. So this is called retinal edema. And so what happens is that they do lose a little bit of vision, but luckily for this patient, it all came back. So if you are a spectator in a golf tournament, realize that you're at high risk for being hit in the eye, and if you are hit, go immediately to the emergency room.
So that's, being that there is actually quite a bit, like you were saying, 40,000 people being injured, specifically to the eye, their eyes being injured when they're playing golf, 40,000 people every year. What are the different kinds of trauma that you would expect when it comes to, whether it's the golf ball or it's a club, what kind of trauma are we looking at?
Sometimes we had 4 little children who got injured in the golf course because their parents were teaching the 6-year-old or the 8-year-old how to hit a golf ball. And we usually tell them to please take the child and have a teaching pro because the little kid can't manage the club correctly. And if you don't manage this correctly, he can hit himself in the face, and then he whacks himself and he hits his whole face and the eye. And then you also get injuries where, the little child who is 6 or 8 years old is wandering around looking the wrong way as a golf ball is being hit. Instead of looking forward, the child is looking behind, and you can get injuries that way. Because you don't know, the child may not know where to look, and a lot of people on a public course could be hitting at the same time. And especially for driving ranges, I think it's very important that if you're teaching a child, that you teach him properly to always look in front and don't go around picking up golf balls, because people in a driving range might be hitting you. So there are all sorts of injuries. Some are just to the face, and lucky for us, they missed the eye, so we're happy for that. Just the face gets, a little contused or a little bump here and there or a cut.
Right. And speaking of, you were mentioning children, is there a higher incidence of eye trauma? I guess not specific just to golf, but is there a higher incidence of eye trauma during the summer?
Oh, huge. First of all, I came from Boston and New York, so during July 4th celebrations, people are also doing bad things with firecrackers, legal or illegal, and it goes into the eye. So it's huge incidence of eye trauma for all ophthalmologists in America for July 4th or the big celebrations like Labor Day. So little sparks fly into the eye, or the entire firecracker goes into the eye and explodes, and you immediately go to the hospital and you need surgery. So these are things to watch out for. This is one of the biggest problems we have with fun picnic events involving a lot of people.
Right. And so, kind of going off of that, especially when it comes to golf, being that when it comes to playing these sports, it's usually something that happens very suddenly. What are the most immediate concerns when it comes to eye trauma?
Can they see? Did they lose consciousness? Did they fall backwards? We had one instance where the tennis ball hit the girl in the eye. The woman's 40-ish years old, 40 years old, and she fell backwards and she blacked out. So we knew it was a concussion, and she broke the bones of her orbit. It's called an orbital floor fracture. So she permanently had a little eyelid droop, but she saw fine. Her vision recovered, but you can break the bones of your orbit.
Yeah.
So I think it's important, especially in other ball type injuries. Tennis is like 1.2 per 1,000, so it's not so common. And the tennis ball is kind of big. It fits in your orbit, but it's kind of bigger than that. So you won't get your actual eyeball that much, but you'll break the bones of your orbit. Mm-hmm. And so what'll happen is that you will immediately see double. That's bad. Or you have this black and blue area of upper lid and lower lid, then you know immediately that you broke some bone in your orbit. So it's important to go to the ER and get x-rays right away, and then you'll know. The other things are, in tennis spectator sports, the ball rarely hits a spectator in the eye. It usually hits them in the face or the throat or something like that, but not in the eye, because even though they're playing at high speed, they're not aiming in the crowd. They have better aim. For golf, unfortunately, because there's wind conditions and the ball is smaller, it can blow unexpectedly and it can hit somebody in the eye.
I think definitely something to think about, especially now that the summer's coming up and more people are starting to go out, especially children. But yeah, definitely something to think about. Thank you so much for joining us on this episode of Friday Reports. Please join us next time. If there's anything that you would like the doctor to talk about in depth, please say so in the comments. But other than that, we'll see you guys next time. Thank you.